Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope. Nothing said on the Low Carb MD podcast is medical advice. Please consult your own doctor before making any lifestyle changes.
Hello and welcome back to the Low Carb MD podcast. Tro, oh my gosh, we've out kicked our coverage. So we have a huge leader in the medical freedom movement, a hero of mine. So I'm really excited about our guest today.
I'm super excited. I reached out to her. I was looking through the DMs. I reached out to her like, I don't know, 6 months ago. And then finally I harassed her enough where she agreed. Like, you know what? She decided to step down and stoop down to our lowly internist level and join us here on the Low Carb MD podcast. I'm super excited. I say that with cheekiness and with my New York City sarcasm. So
yeah, and Tro, just going back to the beginning of this podcast, at that time, Professor Noakes, Gary Fettke were under trial for their stance on low carb and cutting out processed food and things like that, all these crazy things. And we thought we were so cutting edge. We're like, okay, we're going to do this thing and be crazy. And then I come across our guest and I see her step way outside. I mean, destroyed any, like ours was like minuscule compared to what she did. I mean, it's just remarkable. So I want people to have a grasp of that, especially during the time when everyone was freaked out and thought we were in this major, we were all going to die basically. So yeah, much respect. So Tro, you can do the rest of the background.
Yeah, absolutely. Just to cover our guest sort of background, besides her advocacy, which has been amazing and inspiring for a lot of us physicians to sort of watch throughout the pandemic. She started out, let's talk about her education, University of North Carolina, Chapel Hill. She went to med school at Georgia, Medical College of Georgia. She did her residency at Stanford University in ENT and sleep medicine. And she is now founded and the director of Breathe MD. And I know she's treated thousands of patients with COVID, vaccine injury and other things. So I'm absolutely excited to have Dr. Mary Bowden here. Very, honored to have you here and stoop down to our level and our lowly internist level here. We're fans of you on social media, and you know that. I've said that to you. We're inspired by what you've gone through. And honestly, to stand up to the FDA and win that lawsuit, I think is just an inspiration for the new generation of doctors to really understand that we don't need to accept everything that sort of, some of the medical freedoms that have evaporated in the past decade. So absolutely excited. Can't wait to hear, the whole story.
Well, thank you so much for having me. I enjoy seeing you on social media, and something on your website that rang true to me is like you were inspired by your own experience, and that is basically what happened to me during COVID. I lived and breathed COVID. I've never had an experience in my career where I saw so many of the patients with the exact same thing and just thousands of people, right? Because normally you see a variety of things that come in. And it was all COVID every day, all day for a couple of years. And then to have, the government you've got government doctors who never treated a COVID patient, right? And they're calling the shots from Zoom calls from the safety of their bedrooms with no firsthand experience, and just dismissing doctors like myself, actually persecuting us, canceling us, trying to take us down and as well as I do, you wouldn't use the same approach to treating a disease if it didn't work. Like, why would I treat thousands of COVID patients with Ivermectin if I didn't find it useful? Because it's very gratifying to have your patients get better. And if they're not getting better, then you switch courses. So that's sort of my best defense with ivermectin. I was actually a skeptic because I'd been using monoclonal antibodies and they worked really well. And then the government took over distribution. And so that's when I switched to ivermectin. But the government really tried to interfere with that. And then we ended up suing them.
Can we give a little, so I'd like to give just a little bit of clarity because many people may not remember exactly what was going on. I know exactly what you're talking about and what happened. So early on in the pandemic, there was a lot of confusion over what therapies would work the best. And there was a lot of sort of a rapid fire from all the sort of university hospitals, not experimenting, but taking medical theory and trying to put it into practice and see what works. Hydroxychloroquine was one of those early on mentioned, as azithromycin at one point was getting thrown around. And monoclonal antibodies devised to basically go after COVID, were widely used initially, and with great success. Seemed to be amazing success, and those were being purchased directly from distributors and from the manufacturers themselves. Even they were opening up accesses. And what happened, very early on is the government actually took that over. So I couldn't go to my rep and say, get me monoclonal antibodies. The government said, actually, you're going to have to come through us and you're going to have to fill out these forms. And I was never able to get an antibody after that, which was, that was November or December of 2020. It was a very scary time. In fact, I had a patient very ill, had to send him to the hospital. I had to beg the infectious disease head to approve the antibodies that were given to these patients who recovered and did great. And by all means, by any statistic, really shouldn't have made it, but they did. They had severe disease. So this was the first, I think, evidence that there was going to be medical obstruction from the central sort of planners. Who knows if they were, trying to actually equitably distribute, or I don't know what their goal was, but it certainly felt like obstruction to me. So can you add to the listener, because they may not know everything that you experienced, and we may have all experienced different things.
Yeah. So I kind of stumbled into COVID. I'm an ear, nose, and throat doctor. So I do see a lot of people coming in with respiratory tract infections. And so I had people coming with these. I remember it was spring break 2020, and people were coming back from their trips sick. And I tried hydroxychloroquine at first, but then when President Trump came out and said it was the next best thing, it was the cure, then our Texas State Board of Pharmacy actually shut it down. We were prohibited from prescribing it. So then I used steroids, breathing treatments, treat for secondary infection, but I didn't have a lot of demand for treatment at that point. I was doing testing, and we had a saliva test. So people came to us because they didn't want to get jabbed up the nose, and we were able to get the results back much more quickly. So that made my little clinic explode. But people didn't really start coming to me for treatment in large volumes until we had the monoclonal antibodies. And like you said, those worked so well. I mean, people would turn around the next day. And initially I could get unlimited amounts. And like you said, you could order it directly from the manufacturer, and they'd be in your office the next day. You could have as many doses as you wanted. But during the third surge of the pandemic, which is the largest surge, and this was 9 months following the rollout of the COVID shots, the government took over distribution of those antibodies, and they became harder and harder to get. And I think it was orchestrated. I think it was part of trying to get the vaccine in everybody, because the government was very upset that there was vaccine hesitancy and people weren't taking it up as they had hoped. So they attacked ivermectin, and they took away monoclonal antibodies.
I'm going to add to that also with the antibodies, and I'm sure Brian remembers this too, but one of the reasons I found initially when they said, the hospitals actually clamped down on the antibodies, was when Omicron was surging, but it was still at a point where it was like 50-50. It was Delta and Omicron. And I was like, how do you know? Like, they're like, well, you can't use this because this is against Delta. And I was like, well, actually, if you look at the data, it's still 50%. So makes no sense to limit the use of this right now. And it just was a very bizarre move. And it didn't make sense to me at the time. And I think, in retrospect, it was clear that this was obstruction or centralization, or at the least, a terrible mistake.
Right.
Brian, I don't know how you felt about it.
Well, you and I had a lot of debates behind the scenes, Joe. I'm like, I think these guys aren't full of it, right? When I watch Pierre Corey up there in tears saying, look, we're using high dose steroids. It's working. Please look into this. Please look into hydroxychloroquine. And we had data. Brian Tyson, who's a big guy down in San Diego area, he was treating tons of patients with hydroxychloroquine with excellent results. And I go, can you show me some data? He goes, here you go, Brian. NIH studies. Fauci's NIH published 6 different areas where it blocked the viral replication of coronavirus. And they go, okay, now you're crazy to use it. And for me, I was curious. So I started reaching out. I called my medical board. I wrote a letter to the California medical board. I said, hey, what am I supposed to do? I'm not going to wait for my patients to turn blue. Like, are you going to come after me if I use these meds? And they wouldn't respond. No response, no response, no response. So I call and I go, what am I supposed to do here? Like, I don't want to get in trouble. Like, and the guy goes, just use your own judgment. He goes, we won't send you anything in writing. And I'm like, what do you mean you won't send me something in writing? Like, what's your stance on this? So I know, because I don't want to get in. Like, you're telling me I don't know if there's a speed limit or not. Just go out and speed, or we may not arrest you later. So I think that's the frustration that a lot of us docs were in. And Mary, just watching you when you were, I'm like, oh my gosh, she's like standing up to these big hospital systems. I mean, this is a machine that we're up against. Your little David fighting Goliath is a massive thing. So you had to be convinced enough by the data that you were seeing.
Yeah. Well, yeah. Like I said, like when you see thousands of people and they respond well to what you're giving them, that's, very affirming. And then, I mean, there's plenty of data as well. And then, that there's ulterior motives to have the treatment suppressed. And like, maybe even at worst case scenario, you say it doesn't work. Well, ivermectin is so safe. I mean, I dug into it before using it. I was paranoid that I was going to hurt somebody. So I went to the original study that Merck submitted to the FDA to get the drug approved. And I looked at the toxicity data, and there's something called the LD50, which is lethal dose 50, the amount of drug that is needed to kill 50% of a lab animal. And the amounts of ivermectin, the LD50 is, it varies depending on the animal, but, 100 to 200 times what we are prescribing for COVID patients. And then I did a literature search, and I tried to find accidental, intentional overdoses from ivermectin, and I could not find anything. Whereas if you do that for Tylenol, there's plenty of studies showing that. So once I was assured it was safe, and again, I was skeptical, then I started using it and then found it to be very effective.
Yes, I think that this is part of the problem. I'm with you. I was skeptical early on. I still would say low risk, maybe, I wouldn't say I've turned the corner, but there's no reason why physicians shouldn't be able to use it and recommend it if they feel like that's going to benefit their patients. And what happened, I think, at that time, which really aggravated me, was we had the FDA saying, dip your pizza in chocolate. And we had, especially in the New York City area, go get vaccinated and get French fries. And then
donuts and lottery tickets.
Exactly. Seeing Walmart say, get a free Coke if you get vaccinated. And then the FDA says, this is a horse dewormer, don't prescribe it, don't use it. So can you, to me, I found that like incredibly unfair. And I'm like, what is going on? I was so...
Come on, y'all, you're not horses, right?
Right. So can you talk to me about what went through? Because then you attacked the beasts themselves. So walk us through that, They,
so the FDA, I mean, you can probably relate to this. Prior to COVID, I never really gave them much thought because I was like, I'm not trying to get a drug approved and it's on the market. And, the FDA was on the back burner of my mind during my career. And they're not allowed to tell the public, and they're not allowed to tell doctors how to use drugs. They're not allowed to give clinical instructions. They're allowed, their role is to approve medications and then move on. But when they put out that horse tweet, well, they put something out in the spring of 2021 on their website all about why you shouldn't take ivermectin for COVID. But the nuclear bomb was August 23rd, I believe, 2021, where they launched the tweet, the horse tweet. And that just had dire consequences. The tweet went viral. They were high-fiving each other behind the scenes, how successful it was. It led to, Joe Rogan getting trashed for taking ivermectin and taking horse medication. But beyond that, it became virtually impossible for me to send a prescription to Walgreens or CVS or Kroger and get it filled. It led to the medical board coming after me and a slew of other doctors. In fact, 3 years ago to this day, the FDA sent a letter to FSMB, which is Federation of State Medical Boards, which is sort of this umbrella organization that acts like it has powers that it really doesn't have. It's a private entity. It's not a government, but somehow FDA sent them a letter warning them about ivermectin and doctors using ivermectin. And the next day I got reported to National Practitioners Data Bank by Methodist Hospital and reported to the Texas Medical Board. And then a slew of other doctors right around this time, December 2021, we all got reported to the medical board and regarding ivermectin prescriptions. So, and then
with no harm proven, right?
Well, yeah, my complaint.
And it's anonymous.
They're anonymous. Although mine came from 2 hospitals and no patient was harmed at all. Patient's very happy. And well, in fact, one of them doesn't even involve a patient at all. It just involves me speaking out on social media. But back to what that tweet did. So even the court systems were using the FDA's stance on ivermectin to, when patients would sue to get ivermectin for loved ones that were in the hospital, the courts were using the FDA as justification to deny them access to ivermectin. And that's just wrong. That's not, they really deviated outside their lane. And so myself and Paul Merrick and Robert Apter, who also had lots of issues regarding ivermectin and getting targeted, we sued the FDA over this. And it took about 1.5 years and we had to appeal. But finally we won. The FDA came to us wanting to settle, and they agreed to do what we wanted them to do, and that was remove the tweet and remove the misinformation from their website. We did not get an apology, but sort of it does set a precedent, an important precedent. It puts them back in their lane. It sets boundaries, and it keeps them from doing this again.
Yeah, that was a huge thing. Yeah, I'm just curious from a professional standpoint. Where did you get the point where you go, okay, I'm just going to treat patients quietly and do my thing over here in my corner of the world, till you go, okay, I'm fighting the beast. I'm going all in. Because when I saw that, I saw the progression. So what was in your mind that said, you know what, this is ridiculous. I'm coming after you guys.
So I was trying to help. So I had the wife of a man who was dying in the hospital reach out to me. And she was suing the hospital to get her husband ivermectin. He had been on a ventilator for a month. They were talking hospice, and she wanted to allow him to try it, and they refused. So she reached out to me to be the expert witness, and I testified, and we won. But the hospital still gave us a lot of pushback. There was all this back and forth. And finally, though, we were given the green light. My nurse goes to the hospital to give the ivermectin, and she's met by an administrator and the police and turned away. And so that happened. And at the same time, I got a notice from a surgery center that I was operating at that they weren't going to let me operate if I wasn't vaccinated. And then I had a patient from Houston Methodist reach out to me, very distraught. She had bladder cancer, and her oncologist told her that she would need to find a new oncologist or new urologist if she did not get the vaccine. This all happened basically on the same day. So I sent a letter to my patients, or an email to my patients, saying, I am prioritizing my practice to treat the unvaccinated, and I will not be taking new patients who are vaccinated, with non-urgent problems. And I actually never upheld that because I was seeing a lot of vaccinated patients that were sick, but it did create quite a stir. And Methodists reached out to me and they said, well, we would never deny patient care And so I did correct it. I sent an email saying, okay, this is they're saying they would never deny care to somebody that wasn't vaccinated. Nonetheless, I got a lot of responses from that email. And so on a single day, I tweeted out 25 times. I said, vaccine mandates are wrong. And then I put a screenshot from one of these emails that I got from patients thanking me for speaking out. And I did that 25 times in one day. And then a few days later, I got a text message from a reporter at the Houston Chronicle saying, can you please verify, is it true that Houston Methodist has suspended your privileges based on comments you made on social media? And I did a double take. I had no idea what they were talking about. And then I go to my email and see the notification. And then I go on Twitter and they're tweeting that they've suspended me, and I'm spreading dangerous misinformation, harmful to the community. And that tweet went viral, and it created just a media, frenzy. And so they wanted me to roll over, but I decided to fight back. So I had a press conference the next day. I announced that I was resigning and suing them. And then the rest is history. But yeah, they turned me into the medical board because they said that I resigned while under investigation, which, that the purpose of that rule is that if you, harmed a patient and then you flee the scene of the crime, but that was not what was happening. It did not involve a patient whatsoever. So, but I'm still fighting the medical board over that. And then the hospital that I tried to help the patient get the ivermectin also turned me into the medical board because they're claiming that I tried to barge into the ICU to give him ivermectin, which was not the case whatsoever. I was basically following what the lawyers were telling me to do because it was part of a lawsuit. But they wanted me to settle, and they said I could make it go away if I paid $5,000 and took 8 hours at CME, and I refused. And so it's just dragging out.
It's insane. And the people, just for context, in that same time when you sent that tweet out, there was so many doctors saying, look, if you're not vaccinated, I'm firing you from my practice. So because I was independent, I'm like, come on over. So people were calling me crying. They go, look, my doctor won't see me anymore. Why not? Because I won't get vaccinated. Will you take me? And like, people would be 10 minutes into an appointment. They go, I got to tell you something. I'm not vaccinated. I'm like, okay. And welcome to the club. What do you want to talk about? So, but it was one of those things. But those doctors who they held up as heroes on social media, they were firing because they were not going to meet their quotas if they didn't get a certain percentage, right? They were getting huge bonuses from the insurance companies. They never disclosed that to their patients, right? So a lot of these big firms were just saying, get rid of those patients because we're not going to get our government bonus, right? So people don't realize, you have to realize what the context was of all this stuff. And that's why when you said that, I was like, oh my goodness, she's going the opposite route, saying I'm taking only unvaccinated people in my practice. I get the point you were making though. And then, you see what the big hospital systems were doing and the major pressures that we were all under, and I could see why most doctors folded. I get it. When I was first out of med school, I had $500,000 in school loans. You're not going to say a heck of a lot. Now that I'm older and on my own, I can kind of speak out more, but I had to move states because I was afraid of the California Medical Board, right? I'm like, I'm not taking a chance. I can't put all my eggs in one basket because they say you're under investigation. Now you can't practice for 3 years. What are you going to do for livelihood?
Right. Well, yeah. And one thing, I didn't work for 7 years. I have 4 kids and I chose to go back and I didn't have to go back. So I'm not financially dependent on working 40 hours a week. I do need to work a little bit, but so that was helpful. I'm independent. And my practice is, I call it direct specialty care. I don't contract with insurance companies. I don't contract with hospitals. I don't contract with the government. So that really lent myself to be able to practice the way I wanted to during the pandemic, which was invaluable.
Yeah, well, I want to come back to that. So, a couple of things that you said that I think are worth like sort of honing in on. There's you're advocating for your patients, right? In spite of sort of central planners out there who are sort of trying to dictate what to do, and they have no idea what the clinical observations are. it's very much like an ivory tower situation. And I understand, a lot of people are scared. Maybe we want to prevent unnecessary harm, but it seemed like unnecessary sort of hegemony, just wanting to control, the situation. And I remember, vaccine mandates are absolutely unacceptable, right? It is against the idea of the physician-patient shared decision-making. You can't, and which is something that every medical association prizes, right? And we have an oath to sort of respect our patients' wishes. So that shared decision-making, which is part of every single, which means, just for the listener, like a doctor and a patient come together and they both decide what treatment to, consider or not, depending on the values, the efficacy, the side effects, right? It's not like a one-way street. You have to do this or you're out. And so when every single doctor was saying, we're not going to treat you if you're not vaccinated, and New York City had mandates. I mean, you're lucky you're in Texas, but New York City and California were very, there was a lot of social pressure and a lot of people just wanted to talk and had concerns. And I was so alarmed that every doc just abandoned that idea of that patient, that physician.
Informed consent of saying, look, here's the risk, here's the benefit. In California, they passed AB 2098 that says, if you say anything bad about the vaccine, we're going to take your medical license. I'm like, okay, I got to tell the truth to my patient that you're holding us to you're destroying medical ethics. Like that was it, and it's got overturned subsequently. But they say anything you say on social media, if you say, "Hey, I saw someone who had a heart attack today right after their vaccine," you lose your medical license. ABIM, American Board of Internal Medicine, I canceled my membership that I had for 20 some years because they wrote me a letter saying, "Hey, look, if you say anything bad about the vaccine, we're going to take your medical license." I'm like, "Well, crap, I can't deal with that," so I changed medical boards, right? Because I'm not like. I have a responsibility to, like, that's what you're saying. I have a responsibility to treating my patient, and I'm going to use the best medicines, the best approach I can. And if we have questions about stuff, we have to question it. That's our job as the physician, right? And they said, you can't question, just do what we tell you to do.
Yeah. We're all in agreement. Okay, so what happens? I'm just curious. So you fight the FDA. You're doing these, you have other sort of lawsuits and problems going. And was it Texas Children's, or we're allowed to say it? Are they
Houston Methodist.
Oh, it's Houston Methodist. Okay, got it. Yeah, it's Houston Methodist.
And, one thing I forgot to mention real quick about them, they were the first to mandate the COVID shots. They did it on April 1st, 2021, and it was 5 months before Biden. So, it was like, for me to go up against them was, they did not appreciate me talking about the mandates because they were the first.
Why do you think they were so fragile? Why do you think they were, why do you think I heard the statistic, 80% of doctors, or I think, according to the AMA, it's 92%. 92%, took the vaccine. That there's other estimates that are maybe 80% when I'm talking about physicians.
Of the first two.
Yeah, correct.
Well, that's only if you wanted to practice medicine. Like, I had so many friends that go, Brian, I can't do surgery. I'm a surgeon. I can't go in the hospital. I can't do it. I can't take care of patients. Like, when you realize that, you had no choice.
I'd like to hear about that, Mary. If you could comment, you're such a vocal advocate, and I think being direct care is the clear issue here. When you're direct care, there's no government, there's no insurance company between you and your patient, right? If I take money from an insurance company, the patient is not my customer, the insurance company is. So when you remove those aspects out of that medical relationship, your focus becomes crystal clear. It's the patient in front of you, right? But I am sure, as an advocate, every doc out there who is in every hospital system probably reached out to you. The ones that were being, had concerns, the ones that were, being forced into something that didn't feel comfortable with. Can you talk a little bit about that? Like, I'm sure I got an influx of calls. I know Brian got an influx of calls. I'm sure you got thousands of calls.
Oh, I did. Yeah, actually. I mean, I got far fewer than I would have expected. I mean, I feel like I have a very large network of doctors now. And at the time, though, it felt very lonely. I remember feeling like I know where are all the other doctors? But
we're here.
I know now I feel like I've got a lot of people, but at the time I felt very alone. And I didn't have, and I had doctor friends that, the deafening silence. It was like the deafening silence of the medical community. And that was my biggest impression, not everybody coming together and trying to help me.
Yeah, everyone, and what I know is a lot of doctors would call me behind the scenes, email me, call, like, keep doing what you're doing. I can't say anything. I'm tied to the system. I can't say anything. I just can't say anything. But it's like, look, you have a responsibility to your patients. If you know these things, and just think about the setting. Back then on social media, you couldn't say the vaccine V word. You couldn't even reference it at all. And we're seeing people come in and we're talking to people, and I interview people like for a long time before I'd have them on the podcast to make sure what they're saying is legit and they're not just some crazy person. But the hatred and the bitterness these people who are vax injured got, and by definition, they weren't anti-vax because they got the dang thing, right? And then they have health problems. So how do we not warn our patients about that? If we knew a drug was causing a problem, no one would say, questioning the drug is not a problem. When people died from Vioxx, we had a responsibility to go, hey, we're seeing these bad things in practice. And those of us on the front lines weren't allowed to speak. And Tony Fauci and Hotez and none of those guys came to us and said, hey, what's working and what's not working? I actually met with Peter McCullough at that time. He goes, Brian, what's working in San Diego? What's not working? And it wasn't him telling me what to do. He was like curious about what's working and what's not. High diabetes, obesity, all these were risk factors of dying of COVID for sure. And, and so these are the things like no one had an interest in. It became political rather than what works for the patient. I think that's what we fell into.
Exactly. Yeah.
How about your nature? Let me just ask your nature. Like you're not an arbitrary to, standing up to the man type thing generally, like in life growing up and stuff. Were you one like a stand up to the system type person, or is this kind of your nature?
I don't know. I mean, I think to get through medical school and residency,
True.
You can't too much. I think that's part of the problem with our profession is you have to be pretty compliant. You have to be a rule follower. Mm-hmm. You have to make good grades, and you can't be a behavior problem. And I wasn't. I remember I got in trouble in residency because they were drawing people's blood at 4 a.m. and then we'd round up them at like 5:30. The lab results would never be back. And so I talked to the director of the lab, like, why are you waking people up? And, what's the whole point of waking them up at 4 a.m. if we don't have the lab results back, that sort of thing, like just trying to make the process better and better for the patient. But then I got labeled as, she's a troublemaker. So things like that. But I probably wouldn't have, if Methodists hadn't come after me the way they did, I don't think you'd know who I was at all, probably. And when I sent that email out, I was sending out just, to my patients. I didn't expect it to make national news. So I don't know. I'd say I'm probably a little more out of the box than most doctors, but compared to the rest of the population, probably very similar to most people.
Well, and I think the other thing is, if you look at the numbers, how many doctors got the initial 2 shots and how many got the latest booster? It's like less than 5%. So they changed somewhere. It's not just because Mary stood up to the system, right? They didn't just change all their views because these crazy anti-vaxxer people. Like, questioning safety on anything is our job. Like, if we're going to shoot something into our patient's body, right? And this is why Nuremberg Code was such a huge deal. Like, well, those of us who understood history were like, this is exactly the same thing that happened. You cannot mandate, even if it's 1 in a trillion chance you could die from this thing. You can't mandate this. So I'm like, how can we mandate something we have no data on? Like, to give it to our military, to give it to our police, to give it to all the doctors and nurses. And you go, oh my gosh. And we were all seeing the design. This is what's frustrating is we were seeing it, at least I was seeing it clinically. I know you were too, because it was happening. Doctors were coming in with myocarditis, pericarditis, PEs out of nowhere. I had 9 nurses with PEs they're in my church. If anyone wants to come talk to me about it, these kind of things. And they're like, oh no, it's not from that. Like, what the hell else is it from? What else did you do different than you've been doing the rest of your life?
Yeah. Yeah. And it is funny. It's like no one's getting these shots anymore, but it's still a radical idea to say that the shot should be pulled off the market. Yet it's so hypocritical, because if you're not following the CDC recommendations, right, then why are you being quiet about it? And that's why I try to tell, doctors and politicians, because the politicians, their job is to protect us from these bureaucratic agencies that are unelected and wielding too much power.
Yeah, and you stood up to that too, which was huge, right? To say, hey, are you gonna look at the risk and benefit of these things and pull them off the market? Are you going to do that? And I'll support you, and we'll get people to support you, because we all know pharma's paying these guys. They're all paid off, right? And when you see that, it's like, oh, I'm going to lose X number of dollars. But it's a real battle. It's a real struggle.
Yeah. I want to come back, because that rabbit hole gets deeper and deeper the farther you go, right? Like, we're talking about the COVID vaccine, and especially the boosters that have no real interventional trial data, no long-term data, and this being a problem, right? No, real placebo. I think they had a placebo for 2 months or 4 months, and they crossed over.
There was no placebo. Once they figured, they crossed it over, they were seeing what they were seeing. We'll see. We have 1 million pages coming out, right? We can look at.
So the problem is, well, here's the problem, right? If you impose this ethical standard, which I think we all should have had for a really long time, if you go back, it goes all the way back to the beginning, right? If you're like, we need, I looked into, maybe you've looked into this more than I have, but I've looked into some of the vaccines on the market now, and some have, really long follow-up. The shingles vaccine has incredibly long follow-up, 3.6 years. The pneumonia vaccine has, 3.2 years of follow-up. The placebo is not a great placebo, but it's a reasonable placebo, I'd imagine. We have some placebo-controlled interventional data with the flu shot. But besides a couple vaccines here and there, we don't have any long-term, truly placebo-controlled data. So if we're talking about, either demanding long-term studies or taking these drugs off the market, the problem I see for the regulators is this goes back really, really far, and it's tackling the entire schedule. And I'm not sure, and I don't know if people are ready for that. I mean, they should be, in my opinion. But I'd like to just hear your thoughts.
It's risk and benefit. It's risk and benefit, right? So you look at the childhood vaccine schedule and you go, how much data do we have? And when Kennedy started talking, I'm like, is this guy nuts or is he right? Right. And you start looking, it's like 3 days, 3 days of follow-up. Seriously? And you got this through with no placebo-controlled trials with our kids, with babies? Then you go, oh my gosh. And I just heard a pediatrician talking, saying, do you know when the blood-brain barrier closes for kids? It's like when they're like 10. And they're getting all this stuff when they're newborns. And you go, oh, crud. Mercury, all these toxins, all this stuff can go to your brain. Is that good?
Right, as far as I know, the blood-brain barrier doesn't close, but
well, it depends on, if you have lipid nanoparticles, it doesn't, right? So there's certain things that will cross for sure. But what I'm saying is, shouldn't we have really, you don't just go, we just built this plane in 3 weeks, we're going to fly it, see what happens. Let's get your family on there. And you go, let's test it first and make sure, right? That's the kind of stuff, that's our job. We've been around long enough to see. I posted about it before. How many drugs approved by the FDA subsequently got removed because people are dying? And it's huge numbers. You go, oh my gosh. But they've made their money and everyone goes, okay, we'll settle the case and we move on. Right. But if there's no liability, what do you do?
Yeah. So I'm curious, Meryl, how do you walk me through when you give this message, which I think is a just message for the COVID vaccine, right? To really examine what we're going to do with this. They've made a ton of money. How do we do this right? I think it's long-term trials or take it off. I think that's absolutely appropriate. But if we take that same principle, how deep does this rabbit hole go? And what should we do?
Well, personally, I will never get another shot again with the data that we have. So that's what I tell when patients say, well, what should I do? I go, well, this is what I would do. Because we don't have the data, first do no harm. And we have this skyrocketing incidence of autism that we have no explanation for. And, the elephant in the room is this massive increase in the shots and the vaccines. So I don't see anything wrong with just halting the whole thing until we actually get good data. A lot of those, vaccine preventable diseases can be treated. I think that there are a lot of diseases out there that are, result from medical neglect more than anything, or patients just not seeking care.
Like obesity, diabetes, hypertension,
Right. But
Yeah,
pneumonia.
because we've neglected those, right? The CDC neglected those for decades.
Now they're saying now we don't gotta look at it. Now they're saying, well, we're seeing this huge increase in rectal cancer. It must be the seed oils. Like, how long have they been around? Right? Is that a contributing factor? But what else could it be that happened in the last 2 years that could be contributing to all these cancers that we're seeing? Like, I personally have seen more, or talked to more family members, friends, and families and neighbors. And I was just at a ranchers and the conference, and they were telling me how many people have cancer. Like, they go, we've never had cancer in our family. Now half the family has cancer now, right? I mean, that's something we got to figure out. But no one seems to be really interested in really diving in and looking and say, okay, let's look at the combination of things. It's so frustrating. It's hard because we want to have the truth, and I think we'll never really have the truth of why so many people died in our hospitals and why so many, like, we those of us who are practicing kind of know, but it's a hard thing because some of those numbers. There's a guy out in the northeast. I can't recall his name, but he's going through the numbers of how people died in the hospitals. You're like, oh my gosh, like their vitals were fine, they get intubated. Like, why would that? That's right.
I mean, I don't know if you had this experience, but I had patients coming to me because they would not go to the hospital and they were really sick. Like, and under other circumstances, I would have called an ambulance and had them taken to the emergency room because their oxygen levels were so low. They walked in my clinic. One guy was in the 60s, right? He had a history of 2 heart attacks. He had a history of throat cancer. He was a veteran and refused to go to the hospital, and had many of those like that I was able to turn around just by bringing them in every day and just slamming them with. I gave them high dose steroids, antibiotics, high dose vitamin C. I go high dose ivermectin, do some antibiotics, and then send them home on oxygen and breathing treatments. And they got better. It was shocking. I mean, it was very educational. But yeah, I think it's very clear that these patients that died from lack of early treatment. I mean, that's my experience.
How did you feel when, because there was a lot of controversy regarding, you mentioned steroids now a couple of times, how you used it, and there was a bit of controversy around the group that I think ran the trials that showed the mortality benefit for steroids. How do we reconcile that the trialists who found out that steroids decreased mortality and severe disease, the same people who said ivermectin doesn't seem to be so effective? Were that, you know what I mean? Like, that's one of the issues I've been battling with. I'd like to say they're a fair group. Do you think that that's accurate?
Well, I don't know which steroid trials you're referring to, and the one
recovery.
My takeaway from residency and reading these studies is that they're all conflicted. They're all, you can find a study to support any claim. And there are over 100 studies supporting the use of ivermectin. And then it's just my clinical experience. If I'm not going to hurt somebody, first do no harm. And then I have thousands of people that I'm treating, and I see what's happening. I mean, that's the biggest evidence I have. I mean,
yeah. And at the time, the standard of care was wait till your patient turns blue and send them to the ER. That was it. That was what we were told, Tro. We had nothing that they would let us treat them with.
Right.
Azithromycin, Zithromax with zinc, Zelenko was showing that's beneficial. You had, McCullough talking about these gargles and nose sprays, things like that subsequently have been shown to be helpful. And you go, just do nothing? Like, is that seriously? And the other thing that was happening is doctors weren't seeing patients anymore. They go, I'll just do phone consults. I'm not going in. I'm not risking my life for you. Right. So people were just sent to the ER because the doctors didn't want to see them. And that's exactly what happened. So people are calling like, you're going to see me in person? Yeah, I'm going to see you in person. I had COVID already. I'm fine. Let's go. Right. It's fine. Yeah, it's crazy. So people like you who had courage got under attack. And that's what was so amazing to me. This whole this whole everything that was happening. And the other thing that was happening is I called at the beginning of this one, we didn't really know. And I heard this stuff about ivermectin, hydroxychloroquine. I called 5 pharmacists that I take care of. They're my patients. I go, what's the stance on ivermectin and hydroxychloroquine? All of them said, the official stance or my stance? Like they knew the pharmacology. And so some of them would be like, and I go, how come no one's using it then? He goes, they're afraid. I go, who's prescribing it? Doctors are giving it to their friends and family because that's what they're going on vacation, they're traveling, and they would give it to their family because they didn't have the courage to give it to other patients. Right. So they assumed it worked. Why would they give it to your own family if you thought it was killing them? It didn't make sense. So it was a lot of that. And they would say, hey, if you want hydroxychloroquine, just don't write it the way you're writing it. Just write it for a 3-month supply because you're using it for rheumatologic stuff. No one questions it. Or if you're using ivermectin for scabies, it's fine. Oh, so a deadly illness, it's too dangerous to use, but for scabies, it's fine. It made no sense.
Right. Yeah, it's still a problem getting today I had a patient tell me that Walgreens filled her ivermectin script, although it was $100 more expensive than going to the compounding pharmacy.
Or they put you on hold for an hour. They go, we're going to look and see if we have it. They'll put you on hold for an hour while you're doing your paperwork. Because as a matter of fact, this happened to me. I had a lady, she did missionary where she came back and she had documented parasite infection. What's the treatment of choice? Ivermectin. So and the pharmacist was yelling at me saying, I'm not giving it. I need a copy of that report before I'll send it to you. I sent the report. She goes, okay, this is the last time. Never call here again to get it. I'm like, well, this is medically indicated. This is not off label. But no one cared if you use Zithromax off label or all these other drugs because they said, we'll give you these drugs, but that's off label too, right?
Right.
Like Paxlovid, they were using off label with the president of the United States, and no one says a word about it.
Paxlovid is a trash drug. I mean, it has 44 severe drug interactions, including with statins. It's toxic to the liver and kidneys. It has an HIV drug with a black box warning on it. It's poorly tolerated because of the metallic taste in the mouth. 20% incidence of rebound, and then a 5-day course is something like $1,000, $1,100. I mean, it's really a bad drug.
Yeah, so there was all that, but they had cool ads on TV, right? And it wasn't like they weren't talking about the risk and benefits and all these things on there, and so they got away with murder, I would say, in a lot of this where there was never like all the ads were coming from our public health agencies, right? They were advertising for this stuff. So that's the situation we're in. And so question it like you're trying to kill grandma. And then, just getting back to the other thing that really struck me with even now, there's a lot of schools you can't get into nursing school unless you've had at least the first 2 vaccines. They're not even asking for a booster. That was from 4 years ago. So I would ask people, what's your basis for that? If it doesn't prevent that, which we know for sure, it doesn't prevent you from getting it or giving it to other people, what is your rationale for mandating it? There's really no rationale that fits. Are you worried about me, but you're not going to tell me I can't smoke and eat cookies every day? Right? Is it about my health?
Right. Compliance.
It's
compliance.
It's the CMS thing, right? So if you go back, and I've discussed this elsewhere, Brian, when they first started demanding hospitals report the vaccination rate of their patients, that was like 2008, 2009, after the swine flu, in that time. And then after the demands to report the number, they put a reward or a penalty for the 90% cutoff for patients. Following year, they did that for the employees. So they said, what are the employee vaccination rates? So it's really a central reward structure that's when they started asking every patient, do you have a flu shot, pneumonia shot? And now COVID has been added to that. So it is it's a reward structure for the hospitals. Which came back to that. I want to ask you, Mary, and Brian also, maybe you can answer it afterwards and we could compare and contrast. If you could have gone back and done this all differently, like you were the head of NIH or CMS or whatever, how would you have approached this? What would your message have been, all throughout the way? If you could have waved your wand, gotten the trials you wanted to get at the times you wanted them, what would that have looked like? I'm just curious,
Well, we've never been able to successfully vaccinate a coronavirus. So I would have scratched that. We never would have gotten that going. I would have really expanded monoclonal antibodies. I would have allowed doctors to use off-label without attacking them. I would have allowed patients to have family members by their side when they died. Sort of, common sense, protect the vulnerable, put, emphasis on common sense health measures, like watching what you eat and getting enough vitamin D and going outside and, more of a minimalist approach from the government instead of what we saw.
Well, if the drug companies came to you and said, Mary, if they said, we will do the trials you want, here, we have this COVID, we have this vaccine, we will do the trials you tell us. And if the Paxlovid came to you and the antibody companies came to you, they said, we're going to do the trials, and the Ivermectin generic manufacturers, like, we're going to do the trials. What would you have liked to see industry do so that you could make the best decisions possible?
Well, I mean, that did happen though, right? And look what happened. I mean, we got trials, we got data.
I don't think the regulators did a good job of saying what was needed, right? That's my opinion.
I don't know how connected they were. I'm just sort of a skeptic of trials that have major financial benefits to the person doing the trial. I just think, the lesson to be learned is talk to doctors who are treating patients and give them a larger microphone and give them some say. And, if they can't come up with anything, then try for the latest and greatest. But, I wasn't like total anti-government. I was a big fan of monoclonal antibodies. It's just, we were in an emergency situation, and to take the measures that they did after us and to push this experimental vaccine on our people, it's just hard to believe that we all stood up with it, allowed it to happen.
Curious, can you answer that one? What would you have done? Like, if you could have waved the magic wand and whatever
I think we knew stuff, Troy. I think we knew stuff. I couldn't believe it. I was watching El Salvador, of all places. Their public health was saying, exercise, get fresh air, drink water, do this, lose weight, do that, get out, do things, and get out in the sun. They did better than we did. The third world does better than we do. Like, really? And so those kind of things, they said, like, people were getting sued by the government for saying add vitamin D3 to the seniors. Like, we had data on that from Indonesia saying it was 98% of people who died of COVID had low vitamin D levels. Well, replace it. What the heck? Is it going to hurt someone to take vitamin D? Get out in the sun a little bit. Let the seniors interact outside, like what Hal did down here in Phoenix. Like, he had zero mortality rate, zero hospitalizations with 6 seniors with dementia, right? Because they were able to interact with each other, and like, you're in an enclosed pod anyways. Like, they're not going anywhere. Like, let them interact with each other. I have patients that were 6 months without seeing a human face. They would knock on the door and say, wait 30 seconds, and then you can get your food and go back in your room. Then you watch the news all day about how everyone's dying of this thing, right? Or watching the tally numbers go crazy. So it was really mismanaged, and saying, like, I would agree the same thing, is saying, let's protect the most vulnerable among us. And then we looked at the data, because if you looked at the data for kids dying of COVID, there's no way in heck you're going to have 6-month-old and newborn babies vaccinated. The risk and benefit was never there. And we knew that. That's why it's frustrating. They say, let's just do it. And if you question it, we're going to take your medical license. Like, wait a minute, let's question it. That's our job. We don't just jump headfirst into a lake. You check and see how deep it is first. And they're telling all the medical professionals, everyone, to jump into the lake without checking the water. If you check the water depth, then you're a fanatical, right? That's our job. Say, hey, it's dangerous. Don't jump feet first, maybe. If you're on the 3rd floor, there was a lot of that happened. And I think a lot of these trials, when you look at it, they were designed to fail. Right? They were designed to fail. And I agree with Mary, the best thing you could have done, if I really cared about public health, I would pull in the Bowdens of the world, Brian Tyson, Peter McCullough. You bring these people in and go, let's have a meeting. Let's do a public forum and see what's working and what's not working. Then you have a decision. If all these people go, yeah, we're using ivermectin, everyone's getting better. Right. And let's say so I had to make this decision at that time when I saw all these guys on the steps talking about, treating patients early. I said, did all these doctors lose their mind at the same time? Or do they really believe in what they're doing? Because it's career suicide. When people question the lockdowns, and we're going, wait a minute, what about what we're seeing now? We predict it, right? I have tweets saying we're going to have an epidemic of drug use, spousal abuse, alcohol abuse, suicides. And all that. What are we seeing now? That's the results of locking down an entire population without having data to support that. So that's the problem, is like, hey, let's look back. And I think this was a learning experience. So people are going to, because, it's so frustrating, because I don't know if you guys saw Hotez like a couple of days ago on January 21st, we're going to have all these disease outbreaks. Like, you can predict the day all these diseases are coming out. Really? Seriously? Right? And you're going to tell us to do the same thing that you told us to do last time after we know. And I think a lot of people are just going to go, we're not doing it. I'll just die of the disease. I'm going to live my life and not die in a corner hiding under my bed. Right. I think that's where a lot of people are at. I don't know. That's just my take. Everyone I talk to says the same thing. They're like, I'm not doing that crap again. Would you, Toro, lock yourself in your room and like use a respirator? Remember, one of the doctors we know has had like a ventilation system in their house and was this crazy thing. And you go, oh my gosh.
Yeah, I mean, I don't think I would have done that, but we didn't do it. I saw the people Lysoling their and I get it. They were Lysoling their Amazon packages, but it's not how respiratory viruses work. I think we had the luxury of being smart docs. I want to cover this ground before we get anywhere. Is there anything else we want to talk about? Anything else you want to mention, Mary, before we move ground on COVID, sort of government policy, regulators, and your fight against them before we move on?
No, I'm kind of excited to talk to you about carnivore.
Yeah, I want to hear about this. So you've gone really down the rabbit hole.
I was surprised when I'm like, she's doing that too. Holy cow. Like, we have a lot in common. This is crazy. Well, so what happened with that?
So, part of it was I had a patient telling me how great he had done on carnivore. And then I had another patient telling me that he was about to do it, and piqued my curiosity. And then I was starting to, have a chronic hip pain. And I think, after all is said and done, I think it's just wear and tear from having 4 boys and constantly carrying a child on my hip. But I was, starting to entertain the idea of surgery. And I'm like, wait, before I do that, I just want to try to eliminate anything that could be causing the inflammation. And then I also went to my OBGYN for a fibroid. And he's like, well, we could do a tummy tuck if we take out your uterus. And I'm like, oh, God. So it was those 2 things. I'm just going to try this carnivore diet. And I wasn't really doing it. I was mostly trying to, help the inflammation in my hip. But what I was just shocked at the weight loss. And, you're snacking on bacon and you're eating like the fatty part of the meat. And I just found that it was just such a paradigm shift. So now I don't really want, I'm not a big drinker, but I would, glass or 2 few times a week. I thought that would be, I'd miss that. And I don't miss the alcohol at all, which is weird. Like if I see a chocolate chip cookie, that is a temptation, but I don't really miss the sweets or crave sweets. I mean, I would say the first month was a little rough. But now I'm really used to it and I don't really have a desire to go back.
So did you gain weight during this whole process, like going through all this stuff with it? Because the big thing we see is stress in females, especially like high stress level, insulin, cortisol, everything gets screwed up. So when people go carnivore, we see these things getting better, inflammation getting better, and gut health getting better, and stress getting better. So it's a management, and so Troy, I've been really on this. A lot of people go carnivore because they have so many gut problems. And then they go carnivore and they're like, oh my gosh, like, what am I doing? And I feel so much better. But this huge stress cortisol thing is probably what you were dealing with, like, and you had to change your diet at that point, maybe, and probably drinking more when you're under such immense, I mean, I can't imagine the stress you were under.
The chocolate chip cookies were always at my office.
Yeah.
I was always grabbing one. And then just having 4 kids. I weigh what I weighed before having 4 kids right now.
Wow.
Yeah,
you look amazing.
Never thought that would happen.
Yeah, I think it's so you were inspired by a patient who was like, hey, and you were like, enough is enough. I want to do something about it. So, and you notice if you look at the data for very low carb ketogenic diets and elimination diets, people feel lousy for a month. I messaged you. I'm like, if you're doing this, you should be calling me. because your salt you're going to pee out so much salt. It's really miserable. Salt intake usually has to go up, which is antithesis to what we've been told, right? But when your insulin goes really low, the electrolytes go. So salt and calcium are super important, initially. And then the other thing I wish you would have called me next time, call me, but then the other thing, the reports on alcohol, this is consistent in the literature. If Volkow did a study at the end, this is the one thing the NIH did that was probably good. They did a study inpatient looking at alcohol detox using randomized the ketogenic diet and a normal diet. And the ketogenic diet actually decreased the need for benzos and withdrawal and decreased cravings for alcohol. So this is something we've seen, fairly consistently, an impact on alcohol, and it's been shown in an NIH study. So I'm not surprised to see all that. So how many months in are you in now? And what is your what was yesterday's food? I'm just curious, for the listener,
So I started August 1st. So what's that? August, September, October, November.
4 months in now.
4 months, yeah.
Yeah. So yesterday I had 3 eggs. I had half a package of bacon. I had a ribeye steak. I can't remember what I ate for lunch. I may have just had, I can't remember, but may have had leftover lamb. And then if I snack, I'll grab one of those mini Bonbell cheeses or a handful of nuts or something like that.
So, and how much weight did you lose?
About 20 pounds.
That's pretty darn
on your
great.
frame. That's crazy. Yeah, that's amazing.
What happened to the hip pain?
I still get it here and there. But I've started exercising more, and I think that's exacerbating it.
Yeah.
I'm trying to get my muscle mass now toned. And so I think it did go away for a while, and now I'm doing more weights, and I think it's exacerbating it.
Yeah. You may want to work in, high intensity, low volume approaches work really, really well for resistance training. It's tough. That's awesome. So you're really over the hump. I mean, you went through years of stress and now you're let me get my life back. That's good to hear,
So what do you do now that you're not controversial anymore? When they go, oh, she was right. That crazy doctor that everyone thought was crazy. What do you do?
I'm still at odds with the medical board. So I still feel a constant sense of outrage.
Well, you had a random audit?
Right.
Random. Just totally random, Tro.
Right.
After you testify against these guys, you get a random audit.
Exactly. Yeah. I don't know. I don't feel like I'm out of the woods yet.
So why do you think you're still on the radar? Why don't you think they go, she was kind of right on some of this stuff. Maybe we should just part our ways.
I know, you would think. I mean, I am very vocal about them on social media, which I think might, maybe that's part of the problem, but
you think they would just want you to go away and go, just shut up and do your thing and leave us alone, and then we'll leave you alone, right?
That's my strategy, right? But apparently
it doesn't work that way.
Mm-hmm.
Yeah, I got one more question for you, and I know you've been so gracious. It's been over an hour you've been with us, and hopefully we got a couple more minutes to sort of round things out. I can go into all the terrors of the central planners and what they did to nutrition. I'm not going to go into all that, but I'm curious, with what you've experienced, what you've been through, there's going to be a med student who's listening to this. There's going to be a resident who's listening to this, a young doctor just starting their career. And I'm just curious, if you could go back 5 years, talk to yourself, you can go back, and reach those med students just starting their careers or the nursing student. What would you say to them? What are the values you want them to have? What, what, I don't know, what diet should they be doing? How, what's your advice? I'm curious to hear how you take your learned experience and pass it on to the next generation.
Well, be true to yourself. Go with your gut. Listen to your patients and have the humility to learn from your patients. I learn from my patients every day. And keep an open mind. Don't be rigid in your thinking.
Yeah, I can't agree. Brian, I'm curious if you could go back 7 years, what would you say?
I would say, I had a mentor tell me, he said, never allow your lifestyle to dictate how you practice medicine. Right. Never allow, like, you have to make extra money. You got to get that extra bonus. Why are you there in the first place to take care of patients? And I think that's what we all proved over the last 4 years, because we were willing to walk away from medicine. I had this talk with my wife. I go, I may have to find something else to do. I mean, in California, it was nuts. I mean, what they would do to you. And you go, this is crazy for your First Amendment rights. Like, we should be able to speak out. And then these people are crazy. We're not going to them as patients. They have no idea what they're talking about, right? And a lot of people probably felt that way. I actually had a patient leave my practice because I discussed the risk and benefits of the vaccine. I go, here's the risk, here's the benefits, here's the potential risk, here's what happened to my friend. And she left my practice. 2 years later, she called me and said, "Hey, doc, I just wanted to talk to you. I got diagnosed with metastatic pancreatic cancer. My husband had a heart attack after his booster." And she goes, "I just wanted to let you know you were right, and I was wrong for leaving you, and I should have listened to you." And I was like, "Oh my gosh!" Like, I was surprised. Like, I was just telling the risk and benefits. I don't get paid any more or less if you get this thing or not. But I want what's best for you, because I'm going to be taking care of you. And I think a lot of us docs are going to be what's coming is, it's a disaster. It's a nightmare, because none of us want to see sick people. That's why we do what we do. That's why you're doing carnivore. That's why you're helping your people. So if you can help someone and their sinus congestion goes away, then you can help the next person, right? So I think that's what I would say is always maintain your integrity and do the right thing for the patient. We all learned that if you do the right thing for the patient, it can cost you significantly. None of us going through what you went through, Mary, but the potential was there, right? We just didn't have the right people to target us, because I know we've had anonymous complaints to the medical board, and you have to go and deal with this stupid stuff about something dumb that someone you never even interacted with or talked to. It's crazy. They weren't your patient with a bad outcome. Before it was like the medical board, if someone smoked pot in their office or they had sex with their staff, or something crazy like that. It was never
sexual deviance, right?
Yeah, it was always sexual deviance or some crazy thing. You're like, you were doing what in your office? Like total violation. It wasn't like, oh, they chose this med over this med.
Right.
Right. It was like, use clinical judgment. We have to be able to free our doctors up for that. I would say, look, trust your judgment and what you're seeing, not what they tell you.
Right.
So many drugs came out. They go, this is the next miracle drug. Is it?
Well, yeah, the one of the last and best pieces of advice I got, and I literally think it was on the last day of my residency, our chief said to us, don't be the first to jump on the latest and greatest medication. Wait, let it stand the test of time, but don't be one of the first ones to prescribe a new drug.
Yeah, don't be the first and don't be the last, right? Like, wait and see. Right. Wait and see what happens. Let other people's patients be the guinea pigs, and then you can see before you put your patients in there. What would you say, Tro?
I'm listening to you guys, and I and I think it's okay. Like, I have a slight difference of opinion, both on the regulator standpoint and I trust my clinical observation, but I expect more from our regulators to industry. I think we need to, we can't just rely on our clinical observations to convince other people, right? I think the clinical observations convince us, right? They do a good job of telling us, I see what happened in front of me, and I know how I'm going to treat my patients. That I buy. But I'd like to see more be asked of industry. I'd like to see the regulators say we need long-term trials. It should be standard, so that every doctor out there who doesn't rely as much as we all do on clinical observation, that they have the power to go, they have the information they need to know if something's safe, to know if something is effective. We need to, I'd love to see us demand better trials from the industry, and trials that actually we want, because there may be some drugs that work amazingly, and we should discover those drugs, and we should know that they're safe, and we should have a way to watch this long-term safety signals, right? Like, in an earnest way. So if I could go back and talk to myself from 5 years ago, talk to a med student, I would say demand more from your regulators, demand the people that are regulating industry, demand more from them. When I'm talking about regulators, I mean the people who say, this is what we need for a drug to be approved. These are the trials we should do. Demand more from the NIH. Demand that they do things that matter to people, and don't let them, and don't be captured. And you don't need to fear, you don't need to fear standing up for yourself and standing against anything. I stood against Yale's vaccine policy in 2011 as an intern, right? I said, I'm not going to do it, right? And they came to me, they made me chief resident, Brian, after, like ripping me a new butthole, excuse my, right? So when I was an intern, so
well, I think they see it. We can't just
we can
blindly
make change.
follow. You got to question things and say, okay, look, this isn't right. So we have to figure this out. And I think, I want to end on this note. What do we think about the incoming NIH director, Jay Bhattacharya, right?
Yeah.
Kennedy coming in. Like, what do you think? I mean, I think there's going to be fundamental changes made. Or do you think the system is too far bought off that these guys can't really get in there and make a difference?
It remains to be seen. I was very excited when Kennedy was appointed or chosen, or we'll see if he actually gets confirmed. But and I think Bhattacharya is great too. But we've also got Dr. Oz and Dr. Meshawit, and so I don't know. Who knows what's going to happen? But it's certainly a lot better than having Kamala there and her cronies. So we'll just keep. I'm just going to keep screaming on social media. And I think,
we have to hold everyone's feet to the fire, right? There's no one that we say, okay, you're above. We have to say, this is a dumb move. I agree with you on Oz.
I'd like to see us not relaxing, physicians, like we need to make medicine a very sacred, a profession again. And I don't care if it's Republican or Democrat. I'm happy that there's, Kennedy's a Democrat and he's in there. It's not about being Republican or Democrat for me. We have to make this profession special again. We have to make the industry accountable, liable. We have to show them the studies they need to do. And I'm with you, Mary. There's a bit of skepticism of me with some of the new picks. It's lackluster. And there's some people in those circles that I know I mean, you can see it from a mile away is grift. And so I'm very cautious about, what happens next. And I think we should maintain the pressure that we shouldn't relax. None of us should relax.
I agree.
I agree. I think but I think some of these guys, their integrity, some of them I can't even imagine why you would pick them. But the ones that stood through the fire, like Dr. J. I mean, a lot of these people who stood in the fire. So hopefully, they're up against a machine, like with the money and the greed and the, influence and all that kind of stuff. So, I pray for their safety, that they can and their integrity, that they can say, okay, let's do the right thing for the people. Let's just get rid of this BS, get rid of this advertising, stupid stuff. We got to discuss risk and benefits, and we have to reassess what we've done and make amends for stuff. I mean, there's going to be some money paid out. There was some big money is going to be paid out at some point. So I think it's those kind of things. We have to maintain our integrity. So I vote for you, Mary, to go up there and show them what to do. I trust you in all this stuff.
Can we get you in there?
It's funny because the Maha people had all of us, fill out these applications. We actually took personality tests and all this stuff. And, but it seems like I don't think any of us are really going to get, I think we're too controversial to be picked.
Yeah, we'll see. Personality test crud, bro. I'm not even going to fill out the paperwork.
Yeah, well, I mean, that was my response, Brian. Some personality test. I was like, you should go see if you really want to, if you really want my help, go look at what I've said. That was my.
Look at our online presence and then get back to us. Okay, maybe next year we'll call you.
All right, guys.
Thanks so much, Mary. It was so awesome to have you. Thank you for all you do. And really, I went from saying, oh, she's crazy. Oh, she's got a point. I mean, right. Seriously, I wanted to fly under the radar as much as I could and go, okay, I'm just going to throw it. Now I know Jesus spoke in parables because they go, it's a parable. I didn't say anything about the facts, but everyone knew what I was saying. So I think there's things like that, but you just stood up to the giant and it's like much respect because I'm like, you against these huge forces, it's incredible. These hospitals, people don't realize how much power they have over our lives. And it's amazing.
Bigger than Goliath. They're bigger than Goliath.
So Troy, do you have an ending word for us?
How can the listener, if they How can they help you? I mean, the legal expenses must be insane. I don't know anything. If you have how can the average person either get in contact with you or help you if they're listening to this?
Well, I think I'm trying to grow my reach on Twitter or X because that's what they tried to silence me.
Mm.
So the more followers, the more subscribers, and it's only $2 a month to subscribe. But more of that, and that just makes my voice louder. And I will call everybody out for as long as I can.
And that's at MD Breathe, right?
Right.
All right. So anyone listening, join her, follow her. I mean, she stood in the gap for you. That's the reality. A lot of us stood in the gap and, paid penalties and went through a lot of life stress. Look at these gray hairs and everything. So, support these people, get out there and do your thing. $2, big deal, right? Skip your Starbucks for a day or two.
Yeah,
So,
I just want to. What's that? That's half a Starbucks. You can tell Brian.
Yeah, it's not even half a Starbucks. Yeah, I don't go very often. I protest them. So, yeah.
All right. Thank you so much, Dr. Bowden. I'm just honored that you came on. Keep doing what you're doing.
And Merry Christmas to you. Happy 2025. I think there's some big changes coming, so we're excited.
Yeah. Well, good. Thank you. And Merry Christmas, and we'll stay in touch.
If you enjoy the show, please consider supporting us on Patreon by going to lowcarbmd.com.